Good afternoon, everyone. I am Rhonda Smith, the Executive Director of the California Black Health Network, and welcome to the fifth and final session in our five-part series of Making the Healthcare System Work Better for You. Today's topic is how to participate in the decision-making for your care. So participating in decision-making for your own healthcare is crucial because it empowers you to really understand your health condition, your treatment options, the potential risk and benefits associated with those options, and the implications of what they really mean for you. This all leads to an increased satisfaction with your care, hopefully, and potentially improved health outcomes. Essentially, it allows you to be an active partner and participant in managing your health rather than passively accepting decisions made by other people, like your provider or healthcare team. So feeling empowered about making your decisions not only leads to greater satisfaction with your care, but it helps to create a stronger partnership and relationship with your healthcare provider and team. So the question of the day is, how do we participate in the decision-making for our own health and healthcare in a way that does make the healthcare system work better for us? So we are very fortunate to have the opportunity to partner with the California Healthcare Foundation to provide the answer to this question and more. The partnership with the Healthcare Foundation enables us to elevate health education and health literacy through the How Do I campaign, which is an initiative to provide the knowledge, skills, tools, and resources to empower Black Californians to take charge of their health and health care and really own the power when interacting with the healthcare system. So we want to make sure that our work through the How Do I campaign helps our community know how to navigate this complex healthcare system of ours so that we are all seen and heard, and ensure that we get the care we need and so deserve, and also ensure that the healthcare system is more responsive to our needs. So once again, we are delighted to have as our subject matter expert for today and featured speaker for the series, Dr. Glenda Newell-Harris, who is the co-author of Focus on Your Best Health, The Smart Guide to the Healthcare You Deserve. The book was created to teach healthcare consumers like you all how to communicate, navigate, and advocate for themselves when interacting with the healthcare system. Now, before we start the program, I just want to cover a few housekeeping items. So we'll, just like all the other four sessions, we'll hear from Dr. Newell-Harris, followed by a Q&A. So the chat box is available to give a shout out to people that you recognize that are here today. Make some comments if you want, but if you have a question, please try to put your question in the Q&A box at any point during the session. Please also note that everyone will remain muted and off camera until the end of the session. So could you share the slides, please? So yeah, just want to share for those of you who may not know and may be new to the session today, a little bit about the California Black Health Network. So we are a Black-led statewide organization that works to advance health equity for all Black Californians, and that includes African Americans as well as Black immigrants. We do outreach, education, policy, and advocacy and programmatic work to close the gap in health disparities and advance health equity for all Black Californians, and we do that through looking at a lens at the intersection of racial justice, social justice, and environmental justice. Next slide, please. And our vision is very aspirational. We envision a California where every African American and Black immigrant has the opportunity to live a long, healthy life that's free from racism, violence, and health inequities. And we work to do that every day through our mission, which is to ensure that every Black Californian, no matter how well educated they are, no matter how much money they make, no matter where they live or who they love, how they self-identify, or even their housing status, or definitely where they're from, has the opportunity to get access to high quality, equitable, primary, as well as behavioral health care, and definitely not succumb to diseases that are preventable. Next slide, please. And so our speaker today is Dr. Glenda Newell-Harris. Dr. Harris is a distinguished author, speaker, and patient advocate. She has a career that spans decades and has been at the forefront of addressing health disparities and championing equal access to high quality healthcare for all. She has been providing healthcare to diverse and underrepresented populations for the majority of her career. She is a physician leader in internal medicine and a trusted voice and go-to expert for her patients, family, friends, and communities around the world. She educates on issues around healthcare and health advocacy, and her mission to empower stems from being on both sides of the doctor-patient relationship and from an extraordinary life experience. Dr. Glenda received her BS degree in biology from Tufts University in Massachusetts. She received her medical degree from the University of Cincinnati School of Medicine. And most of all, to mention, it's very important that in February of 2024, she was appointed by President Biden to serve on the advisory committee for the Office of Minority Health. And so without further ado, I will turn it over to Dr. Glenda to talk about how we can participate in decision-making for our care.
Thank you so much, Rhonda, and thank you again for this opportunity to be here today. This is the final in our series of 5 sessions, and I really want to acknowledge the California Black Health Network for their vision of wanting to share this message with the community. I'm very excited to talk to you today about a very unique topic, but a very important topic, and that is how to participate in the decision-making for your care. Let's go on to the first slide. Now, by way of recap, I'm going to talk about these bullets here, and I really want to talk about them today as it relates to our theme and focus today around medical decision making. You know, medical decision making is very important for the physician to do, but today our focus is going to be your involvement with medical decision making. So one of the topics that we've already covered has to do with patients' rights. And patients' rights is going to be very much a component of what is factored into your armamentarium of helping to work with your doctor on decision making for your health care or the health care of your loved one. Number 2, effective communication, which is another session that we've talked about. Your ability to communicate with your medical provider, with the medical team, all of those that are involved in your care. That is a critical component to having a good medical experience, and it becomes even more important when you begin to get involved in your medical decision making. The next bullet point, navigating the healthcare system. That involves understanding what is basically going on. How are the doctors going to be able to go about identifying the problem and making some recommendations to you about it? And where do you go to get the necessary testing? And is it covered? Do you have to have all of these tests in order to get all this information so that you can be involved in your medical decision making? And then the last, but most importantly, advocacy. And this is really where advocacy will come in, because the doctor or nurse practitioner or provider will come in and they will have their preconceived notions about what the medical decision should be regarding your care. But this is a time when you will have taken the ability to communicate, the ability to navigate and understand, and then to put you first to be able to say, okay, now that I have all that information, now I'm wanting to be involved in the decision that's going to be made about my care and treatment for all types of things. And we'll touch on some of those today. Next slide. So, what is medical decision making? I've identified 3 key components here today. And the first one is collaborative. Collaborative emphasizes that the medical decision making is a 2-way street. You know, we've talked about that a lot in the series, that a lot of what goes on in that exam room should be a 2-way street. It's a relationship between the patient and the provider. The provider offers expertise, medical knowledge and expertise to you, and then the patient is expected to contribute their interests, their values, and of course, raise questions. So collaboration is a critical component to your engagement in medical decision making for yourself or your loved ones. And I do want to touch on the point of your loved ones, because there may be some very, very super healthy people on this call that have really not had confrontations with medical doctors except to get your immunizations or go in for your take your children for well baby checks or your routine preventive exams. But if you hang out here in this world long enough, believe me, you will find yourself in a situation where you will need to make decisions for yourself and or your loved one. The next point I want to bring up is empowerment. Empowering you. It is so important that you are a part not only of collaboration with your provider, but you must be empowered to question things that are being brought to you as explanations for why the provider feels that you have this, that, or the other condition. Because we know, those of us in medicine know, that you can have a problem such as nausea, vomiting, and it could ultimately be related to 10 different problems. So when the doctor comes in and says your nausea, vomiting is because you've got a small bowel obstruction, how do you know? That's a time for you to ask questions. You need to be involved. And if the doctor needs to pull the films down and put them up on the wall and show you that obstructed bowel so that you are comfortable and confident in knowing that this is truly what I have, and you are then part of that decision making. And then the third point here is incorporating equity and inclusion. That is another very, very critical component to decision making, especially for you and your care. Many of us have preconceived ideas and notions about the way things should be taken care of. I'll give you an example. I guess I'll say maybe it's been 20 years ago that when patients, I'm sure all of you have heard about gallbladder problems and gallbladder attacks. So many years ago, when a patient was diagnosed with a gallbladder problem, they were hospitalized, they'd go in for surgery, and they'd probably be in the hospital for several days. But medicine has advanced, and now we do what's called laparoscopic cholecystectomy, ectomy meaning removal of. And so some people may think, wait a minute, the doctor says they're going to operate on me and then they're going to send me home the same day. Oh no, that's not the way my cousin had that done when she had her gallbladder removed. So there are personal experiences, there are some feelings that you may have about your customs, your religious beliefs, and so all of that must be part of the discussion and the decision making when you are in there having a conversation with your provider and you're needing to make a decision about how your particular medical problem will be treated. I'll give you another example. It used to be that when patients were diagnosed with, let's just give you an example of breast cancer, and the decision was made that the patient would have one breast removed or both breasts removed. And patients years back would be in the hospital again for a week. They'd have drains and they'd have to have care to their wounds, and the wounds would have to be dressed by the nurses multiple times of the day. But now, patients can go in and have that kind of procedure done, and they are in the hospital overnight. So that is also important about the understanding of the decision making, because you never want to feel that you got the short end of the deal. Well, why did they keep this one in the hospital for 5 days and the other one was in the hospital only for one day? That is all part of the collaborative, empowering discussion that you will need to have with your doctor so that you are comfortable and confident when the treatment plans are recommended to you. And then there's another part of the medical decision making. What is your post-operative treatment plan? Let's go on to the next slide. Let's focus here for just a moment on the term collaborative. And how does one really engage in a collaborative experience? Well, you'll see here that I have what's listed: build trust with your provider. How do you do that? If you're a healthy person, you're not, going out and having dinner with them on a regular basis. You probably don't even see them when you're grocery shopping. So your question might be, well, how do I build a relationship with my doctor? Well, one way to build a relationship with your doctor is to book and keep your appointments. Many of us feel that we only just need to go to the doctor when we're sick. Oh, I'm feeling well. In fact, I have a family member that had a routine medical problem, and she developed a little minor medical problem before her scheduled routine appointment. And this is a more senior person. And she managed to get care for the immediate problem that she had and got it all fixed. And then when it was time for her regular appointment to see her doctor, her response was, well, I'm fine now. I don't need to go in. Not the case. The doctor needs to see you when you're well. The doctor needs to see you when you're feeling good. And that's important because when you go into the office and you're not feeling well, many doctors will be able to just take a look at you and say, what's going on? Because they can tell from your body language, they can tell from your tone of voice. If you're a person that comes in and you yak it up with the doctor, whether it's sports that you have in common or some TV show, but if you're coming in there quiet, but if the only time you seek the doctor out is when you're ill, then it makes it very difficult for them to be able to have a barometer on what you are up, what happens when you're up and when you're down. So book and keep your appointments, whether you're feeling well or whether you're not feeling well. And that holds true for every appointment, whether it's your primary care doctor, whether it's your cardiologist, your pulmonologist, your podiatrist, your eye doctor. Often we don't want to go to the eye doctor until either the glasses aren't working or you were given a bad report from the DMV and now they say you're restricted and you're trying to figure out what's going on. See the doctor and keep it. That helps to build that relationship. The next thing is open communication and mutual respect will lead to shared decision making. What does open communication mean? That means that you have to be frank with the doctor. You have to be honest with your doctor. If you have been given medication and you really haven't been taking it, tell the doctor the truth. Because we become very confused about why your blood pressure is continuing to be high when we have you on 2 meds and you're only taking 1. We're not going to be upset with you. It actually will help us figure out why things aren't working. So open communication and mutual respect for one another are a very important part in building that trust in that doctor. And why is trust important? Trust is important because generally the relationship between the patient and the doctor becomes critical when you as a patient are compromised. And you've got to then trust that that person is making the right decision for you, not the decision that he or she would make for the patient that came in 3 hours earlier, but understanding and knowing your situation, knowing maybe how stressful your job is or not, knowing that you may be in the sandwich generation and you're taking care of your mother as well as your grandchildren. All of those things are important, and an open communication, mutually respected relationship really helps to build that trust. The third thing here is to ensure patient values and preferences are respected. As I mentioned earlier, there may be religious preferences that we have. There may be racial or ethnic preferences that we have. I think I may have mentioned in a previous workshop, patients that may have, based on their religion, they fast for a certain number of hours in the day. And therefore, they're not eating until the sun goes down. Well, as a physician, you can't turn your back on that patient and say, well, I can't manage your diabetes because you're not following the rules. That is when the doctor says, okay, let's sit down and talk about how we can make this work. That is respecting your values and preferences. And I have to tell you, I think I have been in some situations, quite frankly, and when I have registered some questions to the doctor about some things that I may want to do or that I feel are important, and I'm really wondering, is it okay for me to push this out a couple of days, or do I need to run and go get this blood test today? When the doctor says, you need to travel, you really can't get this blood test done for 2 weeks. That's okay. That's no problem. In fact, I had a doctor say to me once, "Oh, you haven't been walking?" Oh, really? Okay, well, that may reflect. So, Glenda, why don't you hold out on that test for about 3 or 4 weeks until you can get your walking back in? Because again, my doctor wants my numbers to be good just like I want them to be good. Of course, if the blood test is something that you urgently need, then your provider, that trust is to say, no, we're looking at your kidneys today, and we can't wait 3 weeks to find out if your kidney function is getting better or worse. We need to get that done today. So collaborative relationships with your providers with a framework of trust will be very, very important to your medical decision making. Next slide. Empowering you. The whole concept of empowerment and why participation in your care matters. I was thinking of an example to try to help explain in a different kind of way what empowerment means. I really came up with this very interesting one. But there are some ethnicities, and maybe they're not doing this anymore. But I had a medical assistant that worked with me one time that was part of an arranged marriage. She was of marriage age, and she told me, she says, I go home to do that. And her parents identified 3 guys, and she went back and basically interviewed the 3 guys. And I really can't remember who made the final decision. I think the parents heavily weighed on the decision. She had a little bit involved with the decision making. And of course, I was then engaging with her after the marriage had taken place and she had returned back to the United States. Well, can you imagine what it must feel like when you are able to have a say so in a decision like that? You're much more inclined if you have some say so. And by the way, the marriage is going great. They loved each other. It was a match made in heaven. It worked out for them fine. But imagine what it's like when somebody maybe, I mean, you can't even say brings a car. If somebody gave me a car, no matter what kind of car it was, if I didn't have to make the payments, trust and believe, I'd be driving it and very happy. But we make those decisions about the kind of car we drive. We're involved in that because we're going to be paying those notes. So you are more empowered to follow the recommendations that you discuss collaboratively with your physician or nurse practitioner or other provider when you have some say so in the situation. Your involvement and engagement in how you navigate the system, how you communicate your needs and feelings, because sometimes doctors don't know what's on your mind. I guess I can't say sometimes. Most of the time, the doctor doesn't know what's on your mind. They may know what was on the mind of the last 10 patients that were in their office that may have had a similar condition, but you are unique. And as I said before, many providers don't really know all the balls you're juggling. And so when you have a chance to share and ask questions, doctor, do I have to get this done right now? Or can I get this done in a week or 2 weeks? You are inclined to more likely go there on that fifth or sixth day because you should be feeling like, wow, he or she gave me a reprieve. So you being involved is as much an important aspect of this decision making as collaboration and anything else as it relates to decisions around your healthcare. Let's go on to the next slide. Equity and inclusion, overcoming barriers. So we've talked a little bit about this regarding equity and inclusion. It's very, very important that your decisions around your care are tailored to what works for you. I'll give you another example. Something as common as diabetes. There are some people that say, Doc, I don't do needles. I have diabetes. Are you kidding? Where did that come from? I don't eat a lot of sugar. Okay, we establish and understand all of that. But if a patient comes and says, I don't do needles for whatever reason, I had challenges in my family with people engaged in that, whatever the personal, we must be inclusive on whatever the personal preferences are, the beliefs, the lifelong experiences. So when my patients say I don't do needles, I quickly say to them, I don't like needles either. And then the shift is, well, what are the other ways that we could control your diabetes? And there are many pills that can be taken for diabetes. Now, sometimes you can, let me be honest, sometimes you do get to a point where the pills just, your situation is so dire that pills don't work. But for some patients that are motivated, exercise, weight loss, diet, and oral medication can work. So when patients say, I don't do this, that, or the other, this is against my belief, it's important for the provider to honor that with reason and to do everything they can to accommodate. Because once again, you should then feel that you are being taken as an individual, you are personally empowered, they have heard you out. The person before you had no issues with needles, they just didn't like to inject themselves 3 times a day. You don't want to do it at all. And when you go down that path with the doctor and you try the pills and the exercise and the weight loss and the diet, and you have a chance to go in and see the doctor and you see that it's not working out because your numbers are still high, I think it gives you a different mindset and a different shift in terms of coming to the conclusion with your doctor, this isn't working. I don't want to end up with blindness. I don't want to end up on dialysis because my sugars have been running so high for so long. So your involvement in the decision making can also be a process. Let's go on to the next slide. I'm actually going to ask you to move to the next slide, and we're going to come back to this one. Let's talk for a little bit about the questions that you would ask in decision making, and then we'll come back to that other slide. What are all my options? And I just talked a little bit about that as it relates to just diabetes. The same is true of high blood pressure. You want to know, okay, I have this condition. I'm sure you also want to know, well, how did I get it? What happened? Is there something that I did? Does this just happen? How many of your patients have this condition? You may want to know that because it's also very important when you're seeing a provider to know how comfortable are they in taking care of this problem that you have. We've talked about this also in previous sessions. So you want to know from the beginning, okay, I've got a problem. What are the options to treat my problem? And then you also want to know, are we curing my problem or are we treating my problem? That is really an important distinction because there are some matters in medicine that we can fix and cure. Many of them, however, we treat, but we can treat them with your help and your involvement and your empowerment. We treat them and you take care of them and you treat the condition so well, it's as though it's non-existent because you're following the guidelines that are keeping things at sea. The next question, are there non-invasive alternatives? So if the doctor says, you need to have surgery, there's no other option but surgery for this. I'm sure not everybody is excited about jumping on the operating table. I have to tell you, quite frankly, I'm not excited about getting on the operating table. I thought everybody felt that way. But I was talking to a friend the other day, and they said, oh no, my loved one has already had a hip replaced and a knee replaced. And so when the doctor came to him or her and said they needed to have surgery to have this or that done, they just said, oh, okay, take me in. When can I have it done? Let's get it taken care of. Again, you don't know where you're meeting people. So it's important to know, are there some non-invasive ways that my problem can be addressed? And when you're asking that and you're trying to see if you can be treated, you want to know, am I doing myself a disservice by trying this non-invasive approach? It's important for you to ask that question because sometimes trying the non-invasive approach, the non-aggressive approach for a few months It may not do you harm, but it actually can serve to convince you that you really do need the more invasive approach. Next question. How will each option impact my lifestyle and my life? Those are also very important. And honestly, when you're hit with certain diagnoses, basically you're stuck in that office. You're stuck in that point in time of being given that diagnosis. So many of these things you may even forget to ask. This is also the reason why you should bring someone to the doctor with you. When you're faced with getting information that you think is going to require that you have to make decisions about your care, you might want to bring someone with you so that they can hear with hopefully a pair of ears that may be not quite so confused. Look at the situation with a pair of lens that might see your situation being your glass being half full rather than half empty. But you want to know, if I'm going to get this treatment, am I going to be able to drive? Will will I be able to um, go to the spa? Can I still take that trip down to Los Angeles next week? Can I fly? And if I can't, how long am I restricted? And why? Why can't I fly? Because the doctor's not going to know. I can jump on an airplane. The doctor will never know. I'll be back. But I can tell you, these guidelines are created because studies have shown that their complications come about when you don't follow these guidelines. Generally, when you do follow the guidelines, generally it decreases your incidence of side effects. So you want to ask the question, how is this going to, will I lose my hair? Will I have any problems with my vision? Will I be able to get out of bed? I recently had a situation where a doctor said to a patient, if you take this medication, you may find yourself not being able to get out of bed in the morning. Your joints may be hurting all over. You could just feel tired all the time. And my response back was, oh, mercy, who wants to take that medicine? But if it's a medicine that's going to be meaningful to you, to fix your problem, to try uh, to be working toward a cure, as opposed to maybe just a treatment, I challenge you, try it. The doctors are mandated to tell you all of those side effects, but there are so many patients that will take those medications and never have a problem. And you could take the optimistic approach and say, maybe that might be me. But you want to know what kind of lifestyle changes. You want to know what the side effects are. The next question is, how will this decision impact my long-term health? You want to know, is this medicine going to potentially hurt my kidneys in some way? Will this medicine impact my vision? Am I going to get glaucoma from using these eye drops that I'm needing to take for another condition? What are the chances that I might end up with a heart problem from being treated with medicines related to chemotherapy or radiation? What are the chances? And then what are the chances if I just don't take the medicine at all and just deal with whatever I've got? These are the very type of questions that you need to be asking your provider in order to be able to process the information. And we're going to talk about process too. To process the information and really be able to think about, okay, I'm buying into this. I've got to make sure that I understand everything that's going on, and I'm prepared to take that risk that I could end up being the 2% of people that get X or Y or Z. But it's better for me to do this because chances are this is going to fix my problem forever. And I'm hoping I'm going to be on that side. And then the last thing I have here is immediate action necessary, or can I take time to decide? And I think I've touched on that just a little bit today. That's a very important question too, because every single thing that gets discovered in the doctor's office, I'm sure you probably figured out by now, our operating rooms are full. Our specialty offices and clinics are full. Why is that? Why are the specialty clinics and offices full? They're full because we have a doctor shortage. We have a shortage of primary care doctors, and we have a shortage of other doctors as well. And you might say, well, it just doesn't seem that way. Well, let me put it this way. Everybody may want to live in Oakland, but they don't want to live in a smaller town in another area, in a surrounding area of a major metropolitan. So you've got a shortage there. So it may take a while to see a doctor. That's very important too, in terms of the timing of getting in to see someone. But you want to ask that question. Oh, I've got a trip planned to Europe. Doctor will ask you, when is it? Oh, it's in 2 weeks. Do you think my procedure would it be okay if I went and came back and had it done afterwards? The doctor will tell you the truth. And I promise you, if they say you can wait, you can wait. But if they say you shouldn't wait because you're going to be traveling and these types of things can happen to you, and you don't want to have something happen to you when you're traveling and certainly out of the country. You want to listen to the doctor, but you need to tell the doctor what your plans are. That's also part of the joint decision making. If you walk out of the office and say, well, he didn't say I couldn't go, but I'm just going to plan to go anyway, you might want to share that information. Doctor is okay, because here's the other thing. Doctors want you happy too. And if they know that you want to travel across the country to New York to your 2-year-old granddaughter or grandson's birthday party, or you want to get to that graduation of a daughter or son or a sister or a brother, they want you back happy, because they know that they're going to have to put you through a procedure. So they want you to experience all those positive things. And then when you come back, you are connected, locked in with them. It's all about you and the doctor getting whatever you need taken care of and following the guidelines and knowing that your plan is for complete recovery so that you can go back to that 3-year-old birthday party the following year. Now, let's go back to the previous slide, if you would, please. Steps to effective decision making. So the first thing, as we pointed out, is to understand your condition. You want to have that discussion with the doctor. Be sure that you are clear about what is going on with you. And if you don't really understand what is going on with you from a 25 or 30-minute visit with your doc, schedule another appointment. Because there should be no plan or treatment that happens to you that you don't really have a good understanding of. Number 2, weigh your options. Take a look at your situation and take a look at what the options are. Some people say, oh, I don't want to take a pill for the rest of my life. Can you just go take it out, doctor? We had a situation actually not too long ago where I had a patient that was complaining of nausea, vomiting. Now, nausea, vomiting can be anything from the flu, viral gastroenteritis, to an acute appendix, to a bowel obstruction. And this patient was seen in an emergency room setting and had all the proper x-rays. And as it turned out, the surgeons really didn't know what was going on. And in those situations, sometimes they will come to you as the loved one or to you as the patient and say, I can't tell you exactly what's going on, but I've got to go inside and take a look. And that's called an exploratory laparotomy. And you say, we experiment on patients. Well, we don't experiment, but sometimes we just have to go in and explore, because everything is just not revealing by ultrasound or CT scan. And that's when the doctor will come to you and say, we've got to go to the operating room. And you'll say, well, what's wrong? Not sure. But it's life-threatening. We think to not go in. And in this particular situation, this patient had multiple pockets of infection in the abdomen, which is very unusual. And I don't have all the final outcome on all of the reasons. I could speculate. But again, sometimes you have to join in with that doctor and collaborate and make those decisions, even when the doctor's not sure, because sometimes they just have to go. And that's where the trust comes in. You've got to trust that that person has your best interests at hand. And they're going in and taking a look. As it turned out, this patient actually not only had abscesses, they had what was called adhesions, and that's where the bowel sticks one piece of bowel sticks to another piece of bowel. And when bowel is sticking together, you can't get food through it. And that was helping to explain why the person was having the vomiting, but it was even more complicated because there was infection in the bowel. And adhesions don't necessarily always cause infection, but it's a very complex case. Again, in this situation, you didn't have a lot of options to weigh, but you had to weigh the fact that you had to trust the doctor and that your loved one was not doing well and they just had to go in. Consider your preferences. This is where you're asking for the doctor to consider the preferences of you and the family, and then ultimately making a joint decision. It should not be that the doctor comes in and tells you what's going to happen. It should be where the doctor has conversations with you, talks to you about the disease, talks to you about the different options, talks to you about the side effect complication profile, and then you have an opportunity to process all that, and then you come back and then you share with the doctor. You may then have more questions. Well, I'm thinking about this, but I'm not real clear again what those side effects are. So you want to have things clarified. You want to understand the condition, and then you want to choose what your decision is. I call those kind of the 3 C's: clarify, condition, and choose. Next slide. Now, if you can, take your time. Take your time to involve yourself in this decision making. I know all of you that are here on this call, many of you are juggling all kinds of things. You got a full-time job, you're helping out with family, you're working in your nonprofit organizations, you're trying to take care of yourself. Heaven forbid that you would take off at lunchtime and go, walk around the block and get your 30 minutes of exercise in. You're just so busy taking care of everybody else. And then you go to the doctor and you get hit with this information that, you've got a hernia. Maybe it's not life-threatening from the standpoint of chronic, like cancer, but you get hit with a condition that's going to slow you down, stop you dead in your tracks. Take time to process the information. And you might say, well, how much time should I take? Well, I think it's important really that you take all the time you need within reason. And so, yes, you're going to be going to bed thinking about this condition. You're going to be waking up thinking about this condition, because having done whatever the treatment is also very likely going to impact your circle of friends and your family. So if this treatment, if it's surgical, it's going to possibly require that you have somebody that's going to be able to step in and help you with things at home. That's all part of your processing. Because you might be able to do that. You might not be able to do that now, but maybe your sister was planning to come and visit you in the Bay Area for 3 or 4 weeks. And I know her plan maybe wasn't to take care of you, but maybe you might want to decide, well, let me have that done right before she gets here because, she would be able to help me. So you have to, the other thing about processing information is you have to own that condition. And no longer is it somebody else's on a piece of paper. It's you. You've been living your life and you've never had a problem with joints. Well, guess what? It happens. You've been running the Lake Merritt for the last 20 years, and now all of a sudden you're limping and the doctor tells you you've got a torn meniscus and you can't do that marathon. It's real. It happens. Those kind of folks are like, let's hurry up and get it in because I got to get this taken care of because I got to get back out there and run because that's my life and I got to do it. But you need to take time to process the information. Do not rush to make decisions around the plans for treatment and care for yourself, because these are things that you need to live with. And let me also say to you, when you make these decisions about your care and you do it jointly with your doc, then hopefully you will have that trust in that doctor to then follow their guidelines post-operatively. Because your post-operative recovery is as important as the decision that you make to have your treatment done in the first place. If you're supposed to go in and get physical therapy 5 days a week for 3 weeks, what kind of range of motion or improvement will you have in your condition if you only go twice? And then you won't have the doctor to blame that you don't have the bend and flex of your knee. It's because somehow you were not able to make that a priority. Or if the doctor tells you you shouldn't be lifting things because we've just done a hernia repair on you and you shouldn't lift anything more than 5 pounds, it's so important that you follow those guidelines because the docs are speaking from experience. They've read research papers. They've taken care of patients over the years. They've had people come in with complications, and the patients will clearly say, "Oh, yeah, I lifted that case of water out of my car. You know, my wife just had a baby and she can't lift." Well, then neither one of you should be doing it. You need to find somebody else that can do that because the complications just sort of set you back. So once you've involved all of this, you've got the collaborative, you have the empowerment, your personal values and equity and inclusion are involved. You make that decision to take this path for treatment, then follow it all the way to the end. Because many conditions that you have can return you back to a completely normal lifestyle, as though, at least on the surface, that nothing has ever happened. Only you and your doctor know what your pills are. Only you and your doc and your pharmacist will know what your pills are. But as long as you're able to continue life as you have been before, and you've got a great quality of life, that's what matters. Next slide. Seeking a second opinion. We have talked about this also over the series, but when you are in a situation where you are needing to make a medical decision and there are numerous options, this might be the time where you go and speak with another provider about your situation. You may just have a different chemistry with that second opinion person. That second opinion person may share some stories with you that resonate with you, that ring true with you, that will make you say, "Oh, I've heard this before. Oh, yeah, that's what the other doctor said." And it's really good often when the second opinion doctor really doesn't even know the first opinion doctor. That way, you're sort of feeling like you're really getting an objective opinion. But don't hesitate to get a second opinion. I, as a physician, have my own opinion about recommendations that are made to me because that we're the worst kind of patients to be. If you find a doctor that's taking care of another doctor, I mean, honestly, I take my hat off to all my doctors because the fact that they can put up with all the questions, because believe me, I'm just not saying this to you on these webinars. I'm practicing this in my everyday life. But the point being is that, it's okay to ask for a second opinion. And many times when you get that second opinion and that opinion is the same as the first opinion, it actually helps you sometimes to build trust in your first doctor. And then when the next situation comes, you may not feel the need to get a second opinion. If anybody on this call has ever been diagnosed with prostate cancer, they have so many options now for treatment that I have to tell you, I don't know how men make that decision sometimes because they've just got a laundry list of things that they can do. Again, this is where you need to take the time, process the information. And I'm going to say to the men that are on this call, go talk to some friends of yours that have prostate cancer. I hate to admit it, but in Alameda County, it's one of the highest rates of prostate cancer is in Alameda County. And, if you go around the room and count out to 10, you're likely to find at least 1 in 10. So, maybe they don't want to tell you that they've got it, but they can tell you about a friend. And I think talking to other people about what their treatment plan has been like is also another way of getting another opinion from someone that you trust and know, and may give you some feelings around the realistic aspects of what the recovery is going to be like and how you're going to end up on the other side. So seeking a second opinion is something that is also very important in terms of medical decision making. And I believe that ends. Next slide. Okay, the wrap up. Medical decision making is collaborative. It's between you and your healthcare provider. They need to take your personal values and preferences in part of as part of the decision making. Make sure to ask all the right questions. I didn't mention this today, but bring your pencil and paper, write things down, and then enlist a trusted advocate to come with you when you go in for these types of appointments so that you will have another pair of ears listening to the information that you need to hear and process. Next slide. Thank you so much.
Okay, Amber, I think you can stop sharing now. And we do have a few questions in the chat, Dr. Glenda.
Okay.
So someone wants to know, well, let's see, Black women are one of the main racial groups diagnosed with fibroids more than others. Yet it seems that the doctors more strongly recommend a hysterectomy, but not as much for other racial groups. What can we do when the doctor really doesn't offer alternative options? Great question.
That's a great question. Well, as I've said to friends and family, my friends and family, their first doctor is Dr. Google. And so folks go to Dr. Google, and that's where you get the information. I mean, there are medications that can be given to shrink your fibroids. I actually first heard about this probably about 20 some years ago. I was chatting with a female physician, and she was actually flying to Chicago to get her injections. So this is what I would say to you. Let the doctor know that you are aware that there are other options, or ask the doctor if there are other options. And if the doctor's only option for you is surgery, that's a time when you want to seek a second opinion, without question.
Right. And to the point that this person's making, yeah, there are many Black women, present company included, that had problems with uterine fibroids. And I have spoken to other women. At the time, laparoscopic surgery was not an option, unfortunately, more invasive surgery. But getting that information from other women who have gone through a similar situation is, to your point earlier, helpful in making a more well-informed decision. And so someone wants to know, how can sickle cell decisions and collaborations, what can they look like with providers, I think is what they're saying.
I'm sorry, could you repeat that question?
So it says, how can sickle cell decisions and collaborations look like with providers? I think, maybe it's how can you collaborate with a provider if you are a person who is suffering from sickle cell or has that
So
diagnosis.
I think first of all, I want to say hallelujah that we have adults with sickle cell, because I came up under the era where folks didn't make it beyond about 21 with sickle cell anemia. So we have made demonstrative strides. I recommend that people that have sickle cell anemia really should be cared for at a teaching center. I hate to say this, but sickle cell anemia is a disease where there is constant research going on. And to the point of the situation with the fibroids, if you're just sort of practicing, and not getting out there and knowing and attending medical sessions, national ones, international ones, you just don't know. So if they're young people, Children's Hospital has a great sickle cell anemia department. I've worked with them a little bit, really on the soft side. I have an organization, we donate toys, and we are specific about wanting the toys to go to the children in the sickle cell. But that program is or I'm going to call it a wraparound program. You need a social worker involved. You need a hematologist involved. You sometimes need a therapist, a psychologist involved. And so anyone that is dealing with a condition like that, if multidiscipline approach is not offered to you, then you need to ask for it.
Great. And this is a question from someone who has Kaiser, and they want to know, if you are with Kaiser, how do you get a second opinion when you're in an HMO?
Not a problem. Let me tell you, I used to work for Kaiser, and patients would come, and I was working kind of as an urgent care physician, so I didn't have a regular panel of patients. And so I didn't have a relationship with the patients. And so when they would come in, they were seeing me as just Joe Blow. There was no trust. And so the patients would come in and they would either say to me or to a doctor like me, well, I saw Dr. Newell or I saw Dr. Smith the other day and he said I have so and so, but I don't believe it. And I want a second opinion. And now I don't know if this is true now. I suspect it will. I simply wrote, patient wants a second opinion, hematology oncologist regarding XYZ. And the reason why patient is uncertain of the diagnosis, patient is uncomfortable with the recommended treatment. I have to say, when I worked for Kaiser, they were, and this was quite a few years ago, they were open to second opinions.
Great, thank you. In connection with the question they just asked about Kaiser, how can health equity look through the lens of a provider? What would that look like if a provider, I guess, was thinking and being intentional about health equity, when interacting with patients?
Well, I think I have to say that, as I've said before, a doctor can't really read your mind. So if you have certain religious preferences, you're going to have to share them. We're all different religions. And so if you have some practices that are religious based, you're going to have to share them. If you have some personal family matters that say you don't eat, you know, green vegetables is not your thing, but you can do carrots and butternut squash. You've got to share that with. So we cannot expect the doctor to know everything. And then for those of us that are of a certain race or ethnicity, we may think that we know everything. But when I am a physician, I need to be a physician for all ethnicities, the Black, the white, the Asian, you have to be. And I can't be that for everything. And so I think again, it's a two-way street. And if there are things that are being suggested to you that are not jiving or working with your preferences, you just got to share it with the doctor. Now, if the doctor turns around, throws the book at you and says, well, I can't deal with you, then that's when you begin to start thinking about looking elsewhere for a different doctor that might be more open to accepting your preferences.
Okay, so there's two more questions. We'll try to get through them pretty quickly. So would you clarify about how to handle decision making and asking for explanations related to lab tests? Some lab tests show different scale and evaluation for Black and African Americans, say, for example, for kidney function, blood pressure, lung function, and so on. What does it mean, and how not to get offended, I think, and thinking that, I guess they're thinking that they're getting the test because of their race. Like, how do you ask or approach a doctor when race may play a role in their care or not, or, relative to the test?
Mm.
I think
That's
is
a
where.
that's a complex question. And I almost really wish that, that I might be able to have a more one-on-one, but it's really complex. Um, when in an effort, in order for any physician to be able to say that something is applicable to a certain race, they have to have done research with enough people in that race. And I think everybody on this call knows that we don't do clinical trials. That's just not what we do. I don't know why. And then we then become confused about when the studies come out, and then treatment decisions. I have to tell you, treatment decisions are made for us based on clinical trials that are done when we are 2% of the clinical trial. So decisions then are being made about your care, and there's not a representative group of people that looks like you. So in other words, your breast cancer treatment is going to be determined based on 2% of the people in the study being Black. So I will say this to you. Every ethnicity will respond to things very, very differently. I caution any provider that tries to label my care based on my race. I caution that because the clinical research is not done with 80 to 90% of Asians or African Americans or Indians. It is generally done on a different type of population. So and I also would not accept a doctor saying, well, you're African American. So, well, here's one that they'll hear, your white blood cell count. You will hear that your white blood cell count being borderline low is seen in African Americans.
Hmm.
But let me tell you, when you get an infection, to me, all bets are off. Work me up just like you would somebody else because I may have a real problem. So just don't accept it. I know this equity thing can go both ways and it sounds complex, but don't accept that you're Black. So therefore, this is acceptable for you. You might accept it walking out of the office, but don't go to sleep on it. Be vigilant.
So this question kind of relates to health equity or to this race-based question. So how common is it for orthopedic doctors to recommend knee replacement surgery in African American women with osteoarthritis?
Very common. That's very common. Um, it's a long recoup and recovery. I have some colleagues that are orthopedic surgeons, and all surgeons want no complications. So what I often hear from surgeons is, and I know this is a touchy area, so please don't shoot the messenger and don't shoot the orthopedist either, but they want us to be kind of a certain weight because the more weight that you put on that prosthetic joint, the more likely the chances are that you may have some complications. I had a family member that went in for a procedure, and the doctor made a decision instead of stitching up the joint, they glued it together because they're using glue now in surgery. And why? Because it can approximate the skin better and you get a better looking closure. So it looks good. But gluing doesn't work for everybody. But the answer to your question is absolutely. But you don't want to get a knee replacement when you've got osteo at 50 because those knees only last a little over 10 years and you'll be coming back at 65 for another knee. So you want to push out a replacement of a joint as long as possible.
Great. So I want to ask this question, if you'll indulge me just a few more minutes. So
Sure.
Thursday, a week from today, is Thanksgiving, which is also Family Health History Day. And so when we think about decision making and participating in decision making for our care, especially before we get sick, what should that look like, especially in the context of knowing our family history and how important, I should say, family health history and how important that is?
What should we do in
Yeah,
preparation for?
right.
Okay.
So yeah, so making decisions about our health and healthcare before we get sick,
Okay.
when there's not like a serious diagnosis.
Okay. So I think one of the most important things I could say to you today regarding that is know your family history if you can. It is so important to know that you had a family member that died of a heart attack at 45. It's very important to know that you had a grandmother or an aunt that died of breast cancer at 50. Those types of things are critical. The fact that your mother or father has hypertension, that's important, but we got a gazillion medicines to treat you for that. There are certain conditions, though, cancers in particular, heart disease, and dying at an early age. When you know you have these things going on, you then must be proactive in the doctor's office. And you have to then go in and say, my father died of a sudden death at 45 with the heart. I'm now 39 and a half. I'm 45. I'm at the age that my father died. Have I had all the tests? And I will tell you, one of them is an echocardiogram. Have I had all the tests that are going to hopefully prevent me from having a quote sudden death? The same with cancer, in particular with breast cancer. Generally, the screening with breast cancer is around 35 to 40 years old. But if your mother develops breast cancer at 40, then your screening is pushed back 10 years. So you must know your family history. You must be proactive in the doctor's office because you may not have given that history to the doctor. So you can't blame the doctor for not wanting to screen you. And then the other thing is, sort of everything in moderations. I don't ask people to stop drinking, stop eating pie. You can't have any mac and cheese at Thanksgiving. Yes, you can. But maybe you have a tablespoon of mac and cheese or 2 tablespoons of stuffing rather than 3 helpings and push the string beans or the turkey. Um, and maybe you don't have 3 rolls, but you have one. But generally we don't get sick from eating one day. It's when we eat that stuff for 3, 4, 5 weeks at a time. So, pig out on Thanksgiving. I'm sure I will too. but you just don't want to do that on Friday, Saturday, Sunday.
Or
That's the
every
stuff
day.
that gets you in
Right.
or, on into Christmas and say, well, I may as well write off the rest of the year. So be vigilant and knowing your family history and telling your doctor what your history is and what your concern is. Because also, and I'll say this, and I know I'm going over, but at a certain point in your medical life, when you develop certain conditions, they can do genetic testing on you and they can look for problems. And that way, that helps the doctor to alert. And that can help in two ways. That can help them to know that you need to be watched, but it can also be a relief to know, well, you've got this medical condition, but guess what? Your genetic testing doesn't show it's coming through the gene pool. It's something you're smelling or breathing or in the air. You got this from just living in the world. You did not get this as a genetic thing. So having that testing is also very, very valuable when it is offered to you by your physician.
Great. So thank you so much, Dr. Glenda. It has been a pleasure to get to know you and work with you and doing this 5-part series. I really do appreciate you taking the time to help educate our community, and so they can better understand how to make the healthcare system work for them. Just for everybody's own edification, we are going to be doing a session with Dr. Glenda sometime early next year, basically an Ask the Doctor session. So if there are some questions that you didn't get a chance to ask today or that may come up after today, or if they come up in the course of the next couple of months or so when you're interacting with the healthcare system, please make sure you write them down, save them for when we do this session with her. And it'll be more of an interactive dialogue with Dr. Glenda, which I'm looking forward to. Because there's lots of questions that I think always come up for the sessions that we've had. So we just run out of time to get to all of them. So thank you so much.